hands may have missed any lumps or anything, the scans and mammograms pick all these things up for you so that we can tell whether there's something going on and then we can treat it for you effectively. So those are a few signs and symptoms. Bloody nipple discharge as well is also one of the main symptoms that we see in breast cancer. So when you squeeze your nipples and you see any blood or any discharge coming out, you should know that that's not normal, because the normal breast, nothing should come out of your breast unless you're a lactating mother. If you're a lactating mother and you're giving breast milk to a baby, you should get milk coming out, and that's fine. Everything else is not fine, it's not normal at all. So how do you prevent yourself from having breast cancer? Well, there are a few risk factors. So when I mention them, people get alarmed sometimes, but it doesn't mean that when you have these risk factors, you're going to have breast cancer. I mean, you may have one or two and may not even have the breast cancer. You may not even have any and still get breast cancer. So, I mean, I'll still run through them for you, but don't get scared or worried or panicky just because you've heard that there are few risk factors for breast cancer. So you think you're going to also get it? No. So firstly, a positive family history. So let's say your mother had it, your grandmother had it, or an auntie had it. You have a higher chance of getting breast cancer, in your life. So that's a positive family history. Then your diet as well. What you eat is very, very important. Okay. So we encourage you to eat more fruits, more vegetables, less smoking, less alcohol. As for smoking and alcohol, those two, they come everywhere. You can't avoid them. Okay. So healthy diet is very, very, very important. And then exercise as well. If it's even 30 minutes in a day, that's okay. At least 3 to 4 times in a week. Once the body is active, you should be fine. And then overuse of contraceptive pills. Okay. A lot of young women are now fond of using all these pills and stuff, the emergency ones especially. Okay, so let's say you don't get pregnant, so you've had sex, unprotected sex of course, and then you're just going to take the pill. Then in about 3 days time, you're going to do it again and take the pill. All these pills, they're all hormonal things, okay, and they stimulate the growth of breast cancer cells. So we should be very careful with what we take in. Okay, we don't abuse the oral contraceptive pills. If you want to prevent pregnancy, we have better family planning methods out there that you can choose from. Okay, and they even give you a longer protection. We have 3 months, we have some that for 3 to 5 years and all that. So don't abuse the emergency contraceptive pills too much, okay, because